So today is our 11th COVID video update for our community and our staff. We are in our 5th month of this pandemic, and we have had lots of ups and downs. We have had peaks and valleys in our census. We seem to be coming down a little bit right now, but we'll talk about that in a minute. I just want to thank the staff and the community for staying focused on keeping our patients safe and healthy, and keeping our community safe and healthy. So we're certainly in better shape today than we were just a couple of weeks ago. We actually had our census climb all the way to 130 positive COVID patients a couple of weeks ago. Today, we're down to 64, and we have around 23 patients in the ICU today. We're very excited that that number is half of what it was a couple of weeks ago, but I think we also need to make sure that we don't fall into a complacency or thinking that we're on a trend right now, because we don't know where it's going to go coming into this fall. We hope we see the downward trend continuing, but we need to keep being prepared and practicing for worst case scenarios. So we all need to continue doing the best that we can with social distancing, wearing masks, washing our hands all the time. Not just when we're in the hospital, but when we're out in the community, and if we're going out to dinner, or if we're just seeing friends, wear a mask. If you see other people that don't have a mask on, you may kindly remind them that it's best if they wear a mask too. So we continue to stay on top of our PPE. We're very happy with our PPE levels right now. Our supply chain department has been doing incredible work, headed by Rob Milano. Their whole department is going the extra effort to make sure we all have the right amount of PPE and make sure that the PPE that we get is safe to use. The supply chain department is continually working with infection control, is working with Dr. Gordillo, just making sure that we have the right equipment at the right place for the right situations. Staffing continues to be a challenge, especially when we got our census up to 130 COVID patients. We really want to thank the staff for doing everything that they did. We know it's hard work. We know it's just a tremendous burden on people to come in and take care of those patients each and every day. We do have new travelers coming in. Some came in this week, more coming in the next couple of weeks, and that should make a big difference and give really people a break and be able to take some time off if they need it. So when our volumes are high, we are looking at every way we can to discharge patients in a safe and timely manner. One of the ways we've been trying to do that is with telehealth. Telehealth is something that we have all as an industry been learning a lot more about and getting a lot more experience with. We are discharging some patients with telehealth capabilities, and patients go home with monitoring systems so we can make sure they're safe in their homes or wherever they live, and we can continue to monitor them, make sure they're okay, and we can create capacity in the hospital. So testing's been an issue since day one of the pandemic, and we're now 5 months into it. We have a protocol for our testing patients that come in come into the ER, come in for surgery, come in as an inpatient, and we have protocols for how we can test patients that are employees or physicians or others that are in key areas of this community. We're very limited on the number of tests that we can run, either as a stat test or a 24-hour turnaround test. We are continuously trying to figure out ways to expand that number, to get more equipment to be able to do that, or get more reagents to be able to do the test. And we think that we have some more coming within the next couple of weeks. But right now, we're still constrained on how many tests we can do a day. We also want to remind our employees, if you have symptoms, or if you think you might have a flu-like symptom or something that has you worried, call employee health. Please don't come in. Just call employee health and get instructions on what to do. We have processes set up to where we can test you. So throughout this pandemic, the true heroes of this community, of this hospital, have been our employees who've stepped up each and every day to do what's needed and right for our community and our patients. We owe them a debt of gratitude that we can really never repay. However, we are trying to roll out different programs to express that appreciation. One of those is an appreciation pay that you all saw that the board sent out an email about a couple weeks ago. Happy to report that those deposits should be in your checks effective tomorrow. We have other programs coming up. Some of that will be box lunches that we're going to have at the hospital and get to everyone. And then we'll have some other programs as the pandemic keeps going into the future. So every year, whether we have a pandemic or not, we have the possibility of having hurricanes hit this area or severe weather hit the area. This year is certainly no different. The projections are that this may be a very active hurricane season. I will tell you the team is working around the clock, making sure that we are prepared, making sure that we have the resources to provide the community if we actually have a storm come this way. We are working on what should Team A look like, what should Team B look like, how are we going to sleep people in our system, and how are we going to feed everyone, how are we going to take care of child care, and we're going to be rolling out a lot of information on this in the coming weeks. With that said, now's the time to prepare for a storm, not when a storm is actually here. So please take a look at your checklist in your homes. Make sure you have ample supplies. Make sure you have a plan for your home and for your family to be able to take care of them. So I want to wrap up today just by thanking everyone once again for the exceptional work that you continue to do each and every day. I want to thank the community for stepping up and supporting the hospital, the healthcare system, and the employees that work here each and every day. And then finally, let's not forget that we are in election season. August 18th is the election primary. I would just encourage everyone to exercise your constitutional right and go vote. Thank you so much.